Those forced spending cuts sweeping through the federal government are forcing cancer clinics to turn away some patients. What's going on? We asked Lisa Sylvester to take a closer look at this. What are you learning, Lisa?
Wolf, we are getting a better look at how those forced budget cuts are impacting the lives of regular Americans. And for cancer patients, it could mean big changes to where they receive their treatment. At the heart of it is a congressional mandate for a 2% cut for Medicare payments. Thomas McCloskey has non-Hodgkin's lymphoma. He's been coming to this cancer clinic in East Setauket, New York for 9 years. He gets regular infusions for his immune system and occasionally chemotherapy. But the clinic informed him a few weeks ago that he cannot continue his treatment here. The reason? Congress's forced budget cuts have reduced Medicare payments to providers by 2%.
This thing is totally ridiculous. You know, they can't cut 2%. I can cut 2%, and I can without hurting my family. This hurts people. Don't they realize that? Let them come. Let's change their life.
For McCloskey, that means going to a hospital instead, where he fears longer waits and more out-of-pocket expenses. The issue here? The federal government, under the Medicare program, sets the price for drug reimbursement. Oncologist Jeff Vacirca says cancer clinics are already operating at slim margins. What that 2% cut means is they'll be reimbursed at less than the market cost for drugs.
For the drugs that are underwater right now, which tend to be the more expensive ones, if you continue to administer them in your office while you're losing money because the cost is so high, practices won't stay in business.
A survey by the Community Oncology Alliance found 72% of cancer clinics will refuse to take on new Medicare patients or will ask existing patients to find treatment elsewhere. An independent study found the difference between treatment at a hospital and care at a clinic is $6,500 annually. A group of cancer organizations has written letters to lawmakers to press the agency overseeing the Medicare program to exempt cancer drugs and treatment from the 2% cuts. The Centers for Medicare and Medicaid Services won't comment on the issue, but Thomas McCloskey has lots to say.
They make laws and we have to live by them, and it's terrible.
Now, about 66% of chemotherapy patients receive treatment currently at a physician's clinic. If these clinics are no longer offering the cancer treatment, that raises a whole other issue, whether the hospitals can even absorb all of these new patients. So right now, the easiest way to fix this is for Congress to step in to try to get those cancer drugs exempt. Wolf?
Any initiative you're seeing in Congress to do that, Lisa?
Well, it's interesting. Since this news broke within the last 24 hours, since this became apparent that this was an issue, there were some 50 lawmakers on both sides of the political aisle, both Democrats and Republicans, who have reached out to this oncology group saying, we want to support legislation. We want to start legislation to try to fix this. It's not even clear at this point, Wolf, if Congress even intended for cancer drugs to for this to apply to the 2% cut. But that is the reality we're facing. And unless there's some kind of congressional action, unless there's some pressure to bear on the Medicare agency, we're not going to see any of this change, Wolf.
I suspect the pressure will mount. Lisa, thanks very much.